We have a fairly robust clinical nephrology fellowship program for 2 years where you get exposure to acute care nephrology at a level 1 trauma center, which is the only level 1 trauma center in North Louisiana. We have a faculty which is dedicated in making sure that the fellows get and meet their goals during their training in the 2 years that they spend with us. We have a patient population and a hands-on exposure where you get exposure to peritoneal dialysis training, hemodialysis, outpatient clinic rotations, several elective rotations during your fellowship, opportunity to do research, and opportunity to get full interventional training within the 2 years of your nephrology fellowship training. Our fellows spend about 90% of their times at Ochsner LSU Health Shreveport. All their inpatient consult rotations, their elective rotations are at Ochsner LSU Health. They would spend some time at Ochsner New Orleans campus where they would do their transplant rotation. Ochsner New Orleans has a fairly robust transplant program with well over 250 transplants a year. The first year for the fellows is a predominantly hands-on clinical experience with intensive care, a lot of acute care nephrology with ICU patients and patients with acute kidney injuries, patients with a lot of acute pathologies. The fellows usually will rotate in the consult service for about 6 months, and the other 6 months they get an option to do a variety of elective rotations. The electives include rotations in radiology, urology, critical care medicine, and interventional nephrology in the first year. The second year of the fellowship is a variety of electives again. There you have maybe about 1 or 2 months that you do on the floors, but most of the time is going to be divided up among research and options to do other electives. We focus a lot on didactics, conferences, and a variety of journal club, renal pathology conferences, and weekly M&M meetings during the fellowship. The didactic schedule has been revised and updated in the last several years based on the most current ABIM requirements, making sure that all the elements of the training which ASN and ABIM emphasize for nephrology have been included into the program.
Shreveport offers a great quality of life. With a low cost of living, there's a lot of housing opportunity near the campus, which is great for when you're on call. There's little to no traffic, so you can get to your destination in about 10 to 15 minutes. If you'd like to bring your family with you, there are a lot of schooling opportunities, private, public, and Montessori. We also have a lot of athletic programs for youth and adults. There are a lot of festivals that occur throughout the year, including a lot of concerts, indoor and outdoor. There are also many casinos, great local dining, and breweries around town. Shreveport is a great place to live.
Our fellowship program is 2 years clinical nephrology, and we have 2 fellows every year. Besides this, we also have a 1 year of interventional nephrology program. This is for nephrology fellows that have completed the nephrology fellowship in a program with no interventional experience, and these fellows have a keen interest in interventional nephrology. They can do a 1 year of interventional nephrology fellowship with us. The clinical nephrology fellows do get exposure to interventional nephrology within the 2 years of their nephrology fellowship and have an option of doing anywhere between 4 to 6 months of interventional nephrology rotations where they can get well over 125 to 150 procedures every month, giving them ample training to get ASDIN certification. I'm glad you've invested this time in acquainting yourself with the Nephrology Fellowship Training Program at LSU Health Shreveport. I promise you that the 2 years that you invest in your training with us will be well rewarded. My program is well-rounded and gives you comprehensive exposure to all aspects of nephrology and interventional nephrology, and my goal is to ensure that you walk out of here as a competent, well-trained nephrologist.